Chris is a licensed doctor of physical therapy and has over a decade of experience in rehabilitation, orthopedics, and pelvic health. You may have some questions for him as he goes through some teaching today, and I suspect we're all going to learn something. He might learn a few things from us, and I know we'll learn some things from him. So, Chris, I think this is probably most of the guys that will show up today. There may be a latecomer or two coming online here, but why don't you introduce yourself and give us some words of wisdom about how important the pelvic floor related to prostate and prostate cancer patients, how that all works together, and what people like you can do to help us.
All right, good afternoon, everyone. It's always a thank you, Mr. Fred Course, for your introduction. It's always a pleasure to speak in front of every man who I admire, to continue my profession as a physical therapist. And I see each of you as warriors, brave and strong warriors. Has anyone been seeing my slide? Does anyone see my slides? Yeah, awesome. All right, let's start with this one. All right. Okay. So the title of my discussion today is Kegels Don't Fix It All. I spoke to Mr. Of course, and I hear all your sentiments about Kegels, and I hope we can find some answers on all your concerns. And this is definitely a first good step for each of us to to find some solutions in all the concerns that you have. Before I begin, I'd like to share this disclaimer. Please note that this presentation does not replace medical advice or formal evaluation. I encourage you to speak with your doctor or request a referral to a pelvic health specialist. All right. The question that everyone asks, is it Mr. or Mrs. Kegel? I mean, put in your chat box. Well, who do you think is Mr. Kegel is? What gender is? All right. I still don't see any response. Male, Mrs.
Yeah, for some of you who may not use Zoom a lot, you have to open up your chat by looking at the menu at the bottom and click on the chat option.
Gotcha. Okay. Both. Lani, I like that answer. Mrs. All right. All right. Well, you will be surprised, everyone. It's male. This is Dr. Arnold Kegel. He's an American gynecologist who is in late 1940s developed exercises to help women strengthen their pelvic floor muscles after childbirth. These exercises were originally meant to treat urinary incontinence without surgery. And despite his name being a fun fact, despite his name being everywhere, Dr. Kegel never trademarked his exercise. And he actually advocated for avoiding surgery when conservative care could work. That's right. So yeah, it's very surprising for me too that it's the Kegel is the guy behind this exercise is a man, right? I think everyone knows Kegel exercise is mostly female. All right. So let's start with the advice that everyone has received. All of you guys have heard the term, just do your Kegels. Just do your Kegels, you'll get better. You'll not get any concern with your urination or when you go to the bathroom. Well, all of you have heard the term just do your Kegels as if it's a quick fix for everything after the surgery. But here's the truth. Kegels is only a small piece of our recovery puzzle. All right. Has anyone here ever heard of the term canister when it comes to your core? Will you type yes or no in the chat box? Never. Yeah. Yeah. So for Mr. Marshall, yeah. So, and for everyone's understanding, let me explain that your core is more than just your abs. Listen, this one. You see my pointer? All right. So your core is more than just your abs. Think of it as like a pressure can, like a soda can. The top is your diaphragm. That's your main breathing muscle. The bottom is your pelvic floor muscle, and that will be the muscle that we'll be talking most of the time. And the sides are your obliques, your abs, and your back muscles. They all work together to manage the pressure inside. Now, here's the thing. When one part of of that system is off, like maybe you're holding your breath all day, or your pelvic floor is too tight or weak, that pressure builds up and it goes somewhere, usually down. And that's when everyone gets in trouble. So the awareness, getting to know where's the location of each muscle is very important in taking the control back. Let me ask something. Raise your hands or put in your chat box who can still touch their toes. Who can still touch their toes, cut their toenails, or touch the floor? Okay, so we got some. Good. Well, for some, they feel tight, guarded, intimidated, or just little unsure when you go to bed. That's what I call losing your freedom of motion. It's when your body starts moving with hesitation instead of confidence. Your muscles start compensating, your posture gets stiff, and that tension makes symptoms worse. My goal in physical therapy is simple: to help you move, breathe, live, and laugh without fear of restriction. You ever heard the saying, you came at the right time? Well, your pelvic floor muscles need to do exactly. It's not just about being strong, it's about showing up at the right moment. So there's a research on the bottom that shows training your muscles to contract before key movements like standing up, sneezing, or lifting can help you stay dry and regain control faster. Because in pelvic floor recovery, strong is good, perfect timing is better. All right. I'll be putting out some researches for you guys. Tell me if it gets too much, but this is this is the science behind why we are doing what we're doing. So for guys who train their pelvic floor muscles the right way and at the right time, they got dry faster. It's not just strength, it's coordination. Like any good teammate, your pelvic share your slide. All right. Fred Henry's asking if you can you see my slides? Does everyone see?
Yes.
Okay.
Sharing the slides. Chris, can you share your slides?
Oh, well, this is a intellectual property. So I will
Okay.
send some of the
Got
research,
it.
and I could
Yep.
definitely
Okay. No problem.
help you guys for that. So let me go back. So like any teammate, your pelvic muscles have to show up at the right time. So timing is also important. Okay. This next study didn't just ask men how they felt, they measured it. I know most of you guys have started using pad weights, and until now, pads, and until now, people are still using Depends or some slim pads. So this study um, tried to quantify the amount of leakage or urine in their pads, and those numbers said one thing loud and clear: that pelvic floor training works. All right. I got some pelvic floor pizza just to shake it off everything. I hope you guys find this funny. Sometimes I laugh so hard the tears run down my leg because I know that's something that every man or even the woman get to experience the leakage every time with a simple task, which is laughing. It's part of our lives, and we always need to be smiling and jolly. But sometimes we become hesitant because of what we're going through. All right. So there will be some pit stuff along the way. Next is, so now that you know that there's things going on you, how early shall I start pelvic floor physical therapy? I'd like to ask one or two participants to share their story if they're comfortable. What did their doctor ask them to do after they heard the news? I want to know is, have they mentioned physical therapy? So if anyone's comfortable, you could do that.
Well, I'll start out and
Yeah.
somebody else can chime in. I heard little or nothing about really preparing other than a suggestion that I read to someplace about doing Kegels, but I didn't really understand what that was, and too little, too late in my case.
Right.
Oh, I'd like to chime in for a minute too. My doctor had told me pretty early on that I should be doing those, and I was a former marathon runner, so I kind of am OCD, so I kind of did it to the extreme, to the point where I even kind of pulled some of my muscles in the back of my legs because I don't think I had the exact right technique, and a little bit in my hips. But I thank God, because after my surgery, I didn't have any type of leakage at all, and it's been about 2 weeks now. So I used the pads for the first like 4 days, but I didn't have any leaking, and I was just so thrilled about it. But I did do a lot of Kegel exercises, and I had gotten a book and kind of did the arches up and trying to hold it there. And then occasionally when I was urinating, I would stop in the middle for a few seconds, 3 or 4 seconds, to make sure, or 5 seconds, that I was holding it in the right spot. But like I said, I think I might have overdone it. So I would have probably liked having somebody like you to help me as far as a therapist. But that was my kind of story. So I feel like the Kegels probably helped me, unless I'm a little bit younger. I'm 61. So I don't know if maybe being a former marathon runner might have helped me or not. But that's kind of my story out.
Right. Thanks for sharing, Fred and Mr. iPhone. I'm sorry that
So
I
sorry
cannot.
about that. I haven't done a lot of Zoom. My name is Steve Moe, actually. So I'll make sure next time when I log in that I get it right as far as getting my name in there.
But it
Thank
was
you.
nice.
But
Yeah.
yeah, my first name is Steve.
Thank you, Steve, for sharing that. Um, so yeah, I mean, so there are some clients that I've seen who come only after years of their surgery. I got few clients who have come right after their surgery when their catheter was removed. However, they just started doing it on their own. I got one client who called back on me and asking what has been happening. The doctor has told them that after 3, 6 months, it should be going back to their normal routine, or not having difficulty with wearing a lot of pads. But again, it's a journey, and it should be assessed properly, because again, it's not just about doing the Kegels all the time, but thinking about the freedom of motion. Is there any tightness going on, not just on your hips, on your back, but also on your feet? I got clients who I need to stretch their ankle to get all the way to their pelvic floor all the way to their back. So that is something that as a physical therapist could be sharing and assessing to every clients. So yeah, thanks for sharing again, guys. So the answer is 4 to 8 weeks. So this journal has so this study reviewed multiple high quality studies to assess whether pelvic floor muscle training before surgery improved recovery of continence after radical prostatectomy, especially after 3 months of post-operative. The men who did pelvic floor training before surgery were 36% more likely to be dry by 3 months. The next study, this study investigated whether starting pelvic floor muscle training before prostatectomy with the help of biofeedback could reduce the post-operative urinary incontinence. All of my clients have experience using this biofeedback. This is this is what so this machine helps teach the patients exactly how to activate the correct muscles, making training more precise and effective. So this study has shown that when men train their pelvic floor training before the surgery and learn how to do it correctly using a biofeedback, they bounce back faster. So this journal, we call it a clinical practice guidelines. This is from American Urological Association. So according to American Urological Association, men deserve a clear heads up. Incontinence is common after surgery. It improves significantly by 12 months. So that's a good number. That's what everyone was saying, hearing from that. After 12 months, after a year, they should not be wearing pads and they can get their life back. However, some may need ongoing treatment. And while preoperative pelvic floor training is not a strict rule, it can give men a recovery advantage, just like what we have seen in the previous research. Now that you are ready to see a physical therapist who is around your area who specializes on this field, I'd like to know if there's anyone in your head that you could run to and ask if seen a physical therapist. So yeah, so Mr. Fred said yeah.
Chris, I have a question for you.
For sure, yeah.
What's in similar to Steve's situation, I didn't have any incontinence, but I'm also very active and I do a lot of sports and stuff. In fact, just coming back from playing pickleball.
Okay.
And so I might have a squirt here and there from doing sports. Is that common? Do you think I mean, my pads are dry because I use a thin pad just in case when I do sports. But it's just I get maybe an occasional squirt. That's about it. But that's your thoughts on that.
So yeah, Mr. Fred, in my experience, I have seen that that incident is very common because what is going on you is the timing. As you said, you get this leakage once in a while when you're playing sports. Your training for pelvic floor training or with physical therapy should be specific on what you are doing. If it's sports related, then we got to train you on how to automatically clench, squeeze that pelvic floor up and in when you're doing a specific activity. Did I answer your question?
You did, and that's good to know because I don't necessarily understand those techniques. I've been doing my own different things, but to be specific to understand what techniques that I'm doing, if I'm really stretching for something and really being really active, because I do other sports as well.
Right.
I was just doing normal pelvic, but nothing really specific for the sport.
Right.
So I think I probably need to come see you. I need to talk to you anyways, but I need to come probably see you for a face-to-face
Right.
consultation.
Uh-huh. So for look at this when you're having a pelvic floor training. First, everyone needs to be aware of where is the pelvic floor, where is the core, where is the canister. After getting that awareness, you need to activate it on its own, fully on its own, because most when you go out there, it needs to be automatic. Once you get to the awareness and isolated contraction, then you have to translate it to a functional activities, which is for Mr. Fred, it's playing sports. I got a client just lifting a grocery bag. He gets a leakage. I got a client who have been working on about being a dispatcher in the airports. So he never gets a leakage while at home, but he gets a leakage when he's working for 10 hours. So you got to think about how strong and um, how long can a pelvic floor muscle can tolerate your activities, the load that you are putting in to your pelvic floor. All right, so, all right. Any other questions, sir?
Oh, Chris, I was just curious. This is Steve again. Um, if it's can you start doing those pretty quickly after the surgery? Because, like, say for my example, like I mentioned earlier, it's been about 2 weeks, but I still got some healing going on, in particular in my belly button where the longer incision was. But so I've kind of stopped doing them now. But I didn't know if it would, or maybe that's not a question you can answer since you can't see like what I'm up against. But if it would be better to wait like a couple more weeks, or is that okay to gently try starting to do them again? Over.
So pelvic floor training can be done right away once the catheter is done, once the catheter is removed.
Oh, great. Okay, thank you. I just wasn't sure if I should have waited again because, like I said, I was kind of hitting it hard prior, but then maybe I'll start trying to do them again now and just try to, be careful, but just do them more gently, I guess. Okay, thank you.
You're welcome.
Can I can I chime in real quickly,
For
Chris?
sure.
And perhaps maybe you'll get to this. Like the gentleman spoke earlier, I'm very active. I mean, pickleball, cycling occasionally, a lot of things going on in my world, golf. Zero problems there in terms of leakage or anything, but the twist I have is a very wonderful girlfriend. And if there is just a hint of arousal, then the leakage comes, and I don't know how common that is. I looked it up, and Google obviously says, oh yeah, a lot of times that happens. And then the other thing is, I love that one cup of coffee in the morning. And then for purposes of high blood pressure, I take a diuretic, hydrochlorothiazide. And so those two things together, when I gotta go, I gotta go. I can't be messing around. So if I travel, I kind of just like, okay, I gotta decide, do I want this HTC or do I want the coffee? Because I know the coffee can irritate the bladder. I'd be interested to know those two things, ways that you think that can address that, particularly with the leakage, because it's kind of embarrassing when, you're with your girlfriend and all of a sudden, something's kind of, she says a little something or there's a little interaction there, and then oh God, there's this leak. So thank God I wear those little really thin pads just in case. But I'd be interested to hear your thoughts on those two things.
Right. Thanks, Charles, for asking that. That's definitely
I've
a
got
different
exactly the
part
same
of
situation.
our discussion because that's definitely more of a sexual rehabilitation. Although you're experiencing some leakage when you're having an arousal with your partner. For that situation, I would think I need to know how long you've had your surgery. Um, is there any specific position that you get this leakage on? Do you get breathing exercising that helps to
Sorry, there's a lot of interference. I could hardly hear what you're saying. There's someone needs to mute their mic.
now can you guys hear me? Is it better?
Thanks. Go ahead.
All right.
Thank you.
Yeah, so Charles, so in your situation, I think that's definitely a different topic because it's a sexual rehabilitation. However, it's something that you could talk about. We're talking about the leakage when you're having it, when you're with your wife. So we gotta look into it as a whole, not just your physical activity with her, but you have some uh, psychological, arousal with her. So you gotta think about how your brain connects to the pelvic floor muscles. Do you get more excited and that you lose your control with your pelvic floor and you just let it go because you have your excitement with your wife, with your partner? Did I answer that question, Anya?
Kind of, yeah, yeah, that's probably something I need to review.
Yeah,
I just thought that perhaps because the surgery was maybe probably about 3 or 4 years ago.
gotcha.
And so I just noticed that, everything is going along fine. I hadn't had a girlfriend, and then all of a sudden I got a girlfriend, and then these things happened, and then there's that. But you're saying there's some psychological part, not necessarily a medical or physiological part to it.
Right. Yeah, I think it's a combination, especially when you're having this happens when you're in your when you're having an intimacy with your partner. You got to look into it as a whole, not just physically.
Okay.
Hey,
Because
Chris,
it
I'm
didn't.
sorry. This is Juan. I
it-
can't figure out how to raise my hand, so
Right, right.
apologize.
I'll
I
take
want
one
to
more
piggyback
question,
on
then
that.
we'll continue, by the way.
Yeah, I want to piggyback on what the other person just said. I couldn't see who it was either. Yeah, it happens a lot. I had my surgery about 2 years ago, and the same thing. Any type of arousal. I mean, it doesn't have to be anything big. It can be a hug, and all of a sudden, it's a whole leak down your leg.
Exactly.
You know,
Mhm.
and you saying that it has to be mental, but if you're not even thinking about it, it's not something that you consistently think about. Hey, let me tighten up before I give a hug. So and I haven't been trained on how to do the Kegels. I got the band and the ball that Miss Nurse Gray gave me when I had my surgery. She said do this instead of the Kegels. So I haven't had any type of form of Kegel exercise training.
Right. So for one, I think I because pelvic floor is part of your core, and it should just be an automatic thing for everyone. However, for you guys, the connection from brain to the pelvic floor is disrupted because of the surgery. You gotta think about what trauma that you guys have underwent, especially on the nerves behind that prostate. So it not just about the uh the strength of it, but also how it can automatically fire. Um, so yeah, I think I answered that question for you.
I guess there's no fix to it. I guess that's where it is, right? We're doomed.
No, I don't believe that there's no fix on
We're gonna
that.
be we're gonna be leaking. We're gonna be leaking forever, right?
No, I
Just
gotta
sounds like that's probably not something that we would see you for.
yeah. I got a client who have been seeing for 6 months, and he had his surgery for 13 years now, and he got an ultimate dryness on his pad.
Hey, this is
So,
Dave. I
so
had
just
a
can I just continue with this one? Right. So ever wonder why there's a few male pelvic health physical therapists? And I think I got this question asked as well. Um, so to share with you all, I've been a PT for 14 years. treating a wide range of conditions from orthopedic injuries to post-surgical recovery. And in 2020, I began working as a traveling PT, rotating through various clinics across the region. You know, there's one thing really stood out to me wherever I went. Every pelvic health clinic I visited was full of great female providers. Don't get me wrong, they were excellent at what they do, but when I look around, I notice something missing. It's men, not just male providers, but male patients who felt truly comfortable opening up. A lot of guys I saw seemed hesitant, like they were not sure if this was the right space for them. And I totally get it. When it comes to things like bladder issues, pain, sexual function, it's not always easy to talk about, especially if you feel out of place. That experience really opened my eyes. I realized men need something different, something built with them in mind. So I decided to do something about it. What started as an observation quickly turned into a mission to create a space where men can feel seen, supported, and respected while dealing with the most personal health challenges they face. When men go through a prostate surgery and treatments, a lot has changed, not just physically, but emotionally, mentally, and socially. And more often than not, the biggest question that comes up is what's going on with me? So let's talk about prostate, pelvic floor, and their function, and let's get nerdy. So, got a question, Fred?
Well, no, I think you're about to answer it because some of the other gentlemen, I think that the real answer is to reduce the leakage is the strengthening the pelvic floor muscles. And at least that's my belief. The
Right.
Kegel is right is helpful, but really strengthening those muscle groups that influence incontinence, ED, rectal incontinence. There's those core muscles that you have to be able to strengthen that you don't know about, and you don't necessarily get that from the band and the ball. You really
Mm-hmm.
have to understand what are the Kegel floor exercises that are isolating those specific muscles in the pelvic floor.
Gotcha. Yeah. So yeah, it's part of that's what I've said a while ago, that it's not just about the Kegel exercises. You got to look into it holistically. Right? It's not just about the pelvic floor muscles, but also what's around it. As I said, I got the experience of a patient whose ankle is really tight, and I have to work that out, the chain up. So you got to look into it holistically, I would say. And the best person to go to check on that, who studied very well, who took their doctorate degree, have all this training, is a physical therapist, I would say. All right, so just a quick review. After prostate surgery or radiation, it's totally normal to notice changes. Things like bladder leaks, pressure, or shifts in sexual function. That's because around the prostate, the area around the prostate, um, is packed with nerves, bloods, muscles, and blood vessels. Even with the best treatment, those structures can get irritated or disrupted. The nerves that help with erections and bladder control run right along the prostate, so they can get stretched and bruised. That might lead to leaking, less sensation, or changes in how things feel during sex. Blood flow can be affected, making erections less responsive. Then there's this pelvic floor. Those muscles can get weakened, tighten up, or fall out of sync after surgery. So here's the good news. You're not alone, and these symptoms are treatable. With the right pelvic floor training, we can help you regain control, boost function, and feel more like yourself again. So before we get into detail, let's start with the basics. Where is the pelvic floor? And why does it matter after the surgery? I got some video for you guys. Think of the pelvic floor as a group of muscles sitting right on the base of the pelvis, the kind of like of a hammock. It runs from the pubic bone, from the pubic bone to the back of your tailbone and side to side between your hips. And after surgery, these muscles have to pick up the slack. You've lost a structure that used to help with control, and now the pelvic floor becomes your main support team. Just like any other muscles, these get weak, tight, or out of sync. Understanding where they are and how they work is the first real step to getting this control back. So guys come to me and say, Chris, I'm fine most of the time until I laugh with my kids, carry groceries in, or try to move the couch, and then boom, I'm leaking. Sounds familiar? What's going on there is pressure. So when you lift, push, laugh, your belly muscles squeeze, and that pressure pushes down on your bladder, or worse, your rectum. Now, if your pelvic floor muscles are not strong and fast enough to kick in, the pressure wins and accidents happen. Anyway, I heard that you guys go to the gym. I'm sure not everyone has or even tried to. Well, your pelvic floor muscles are not all the different from your workout buddies. You've got the power muscles, the ones that jump in, quickly and handle the heavy stuff, but gas out. Then you've got the endurance muscles, the quiet guys who keep things going all day long without burning out. You need both working together. If you want to stay dry, get hard, and be in control. If you only train one type, guess what? The other one slacks off. And that's when the problems show up. On this study, they presented to see if progressive resistance training, a structured strength program, could help. This wasn't just pelvic floor squeezes. They added whole body resistance training, focusing on core, hips, and lower body. Men who did progressive resistance training showed faster improvement in urinary incontinence, better pelvic floor muscles, and greater overall strength and stability. And those participants regained continence sooner than those who did not do the strength program. So after surgery, the brain and the bladder don't talk the same way anymore. So if you're not actively tuning in, those muscles might not kick in. Your pelvic floor does not work alone. It needs to coordinate with your bladder, rectum, your core, and even your breathing. If it squeezes too early or too late, it cannot properly seal the pipe. So this study by Journal of the American Medical Association found that just learning how to use your pelvic floor the right way consistently can cut the leaks in half. And most men regain functional continence with proper guided behavioral training. Again, with properly guided behavioral training, no high-tech tools needed. You don't always need machines, but you do need good coaching and practice. However, it does not discredit biofeedback or esteem entirely. They still hold value for men who struggle to activate the right muscle, have coordinating issues, and need extra feedback to learn control. Listen, guys, I understand not every guy gets the hang of Kegels right away. Some use the wrong muscles, some just cannot find them. And this study shows electrical stimulation can wake up the pelvic floor, helping men get back control when they cannot do it on their own. So this is my last pit stop, just to cap it off very soon. Word for the day, exhaustipated, too tired to give a shit. Well, this is perfect, no pun intended, to our next topic. Let me ask you something. After a big meal and a trip to the bathroom, do you always feel and say it was a success? Some guys tell me they feel like they're still not empty, like there's something left behind. And when that keeps happening, they start pushing and pushing, which adds more pressure, more tension, and more pelvic health issues. Now take a look at the Bristol chart on the right. The goal is type 3, 4, or 5. That's your ideal range. Not too hard, not too loose. So types 1 and 2, that's where things get tough, literally, hard to pass and puts a lot of strain on your system. And if you're hitting 6 or 7 regularly, that's too loose, then you have a hard time to control and can lead to urgency or accidents. So yeah, even Poops tells a story about what's going on down there.
Oh, excuse me, Chris. I was just curious what your opinion would be on this. I mean, I've been using Benefiber, and it seems like that's really easy for me to drink, and it's simple to put in some water or juice, and it just dissolves. And I just use a few teaspoons each day, and in my opinion, it seems like it's kept me really in good shape as far as each morning I'm able to go without much straining, and then I've been fortunate to not typically go again later in the day. I mean, I'm trying not to eat big meals or anything either, but I don't know, to me, unless it's psychological, but it feels like that Benefiber is really making it fairly simple to deal with, I guess. Over.
So yeah, thanks for that question, Steve. So if you have abdominal issues or problem with your bowel movement, it's recommended to have at least 25 to 40 grams of fibers, and that helps bowel movement. But don't forget that you need to drink at least one half to two-thirds of your body weight in water ounces. So you have to make sure that there's a balance. And of course, you also think about the other medications that you're taking, the supplements that you have, the food that you've been eating. So there's always a big picture about bowel. So this is another story that says by American Urological Association, the pelvic floor muscle training isn't just an option. It's a recommended part of your recovery right after surgery and should be offered throughout the care process. And if conservative strategies don't work by 6 to 12 months, surgery becomes a justified next step. Now, if you're one of many men who don't feel ready for surgery, you're not alone, and that's okay. While surgery is an effective option after 6 to 12 months, if things have not improved, it's not the only path. We can still work on improving coordination, your timing, muscle strength, and we can look at the bladder training, dry needling, lifestyle changes, electrical stimulation, or even revisit how you're doing with the exercises or what you're doing wrong with your sports. Because sometimes it's not about doing more, it's about doing it better. And always remember, progress is not always linear. Even small wins, fewer pads, better sleep, more confidence matter. And my job is to help you move forward at your own pace with a plan that fits you. Surgery
Excuse me.
is a tool and not a deadline. Yep.
Hey, Chris, two questions really. So how do we make pre-Kegel a common practice for future patients? Excuse me, for future patients. I mean, I didn't hear about pre-Kegels. I got the ball in the band. So is there a way that we make pre-Kegels a common practice for future patients?
Pre-Kegel? Pre-Kegel means doing the Kegel exercise before the surgery?
Right.
Yes.
Is that going to be a common practice, or is that just something that?
It is a recommendation, and as we have seen in the previous studies, a lot of men gets a faster recovery after 3 months if they do their Kegel exercises, not just Kegel, but overall general strengthening aerobic training specific to their sports, to their functions, to what they're doing in their previous before the surgery. So definitely, it should be part of your preparation before the surgery.
And I had my surgery. This is Dave. I had my surgery a couple months ago, and I've been talking with Dr. Chestnut. And there was and I've recommended that as soon as somebody gets diagnosed with prostate cancer, they should get the Kegel exercises. And he agrees with that. And there's been other people who have recommended that to him. And he said he's going to start making that part of the initial thing. So when somebody goes for the Monday morning half day thing, or as soon as they get diagnosed, even if they go for active surveillance for a year, he says he's going to give them the Kegel exercise and give them the other exercises maybe recommended as soon as possible.
Okay, and my second question, real quick, is transitioning to Kegel feasible after a couple years, or is there a time limit when you can transition to add Kegels into your, I guess, your daily exercise criteria?
So Kegel will be part of your exercise of your life, I would say. Based on my experience, for those who have who came back to me after 12 or 13 years of surgery, they they're doing their exercises, they're doing their Kegels. So definitely there's no a deadline for that. And by the way, Dave, thank you for sharing that um, to me about Dr. Chestnut. It's very promising, and I would love to meet him so that we can collaborate on helping everyone get diagnosed with prostate cancer, and not just prostate cancer, but for every man who's dealing with any men's health issues. All right, so I would like to proceed on this one. So here's something most doctors don't bring up, and most men don't expect. After prostate surgery, it's common to notice changes down there. Your penis may look shorter, erections feel like a thing of the past, and ejaculation that's off the table after the prostate is removed. It is a complex and ideally a separate day to talk about. But erections depend on three things: good blood flow, supportive muscles to trap the blood, and its ability to relax. If your pelvic floor muscles are too tight, they can cut off circulation or cause pain. If they're too weak, they won't hold the blood in, and that makes erection harder to maintain. And if you're dealing with stress or breathing shallow all day, that just makes it worse. Poor breathing equals poor circulation. So it's not just in your head, your body has to do with it. And this is where I come in. As a male pelvic health physical therapist, who really gets what you're going through, not just from clinical perspective, but as someone who understands how this can be emotionally and culturally. I offer private one-on-one care, just you and me, focus on real issues men face after prostate surgery, like pain, leaking, changes in sex, all of it. You'll get clear explanations, visual tools, and safe space to finally ask the questions you've probably held in for years. That first visit, it's all about hearing your story and building a plan that makes sense for you. We'll chat about what symptoms you're dealing with, like accidents, urgency, discomfort, sexual changes, what goals you have. Do you want a better control, more confidence, less pain? I want to know your lifestyle. What's your medical history? Anything you feel is important. No pressure, no judgment. You only share what you're ready to, and I will guide you through the rest. From there, I'll take a look at how your spine, your hips, your breathing, all, all are working together. Because pelvic health isn't just about down there. It's about how your whole body moves and supports itself. And I just don't assess, I teach. Right there in the session, I'll use simple terms and models to help you understand what's actually happening in your body and see how your symptoms make sense. You will leave with clarity, not confusion. You will walk away with a personalized game plan, exercises and habits you can start that day. There will be no rushing, you will not be overwhelmed, just a step-by-step support at your pace. So if there's one thing I hope you walk away with today, it's this. Pelvic floor recovery isn't just about strength. It's about timing, awareness, and consistency. Whether you're preparing for surgery already in recovery or supporting someone through it, your pelvic floor muscles play a bigger role than most people realize. And the good news is they can be trained. We've seen the research time and again from prestigious and established researchers, from preoperative training to biofeedback. Guys who commit to the process regain control faster, feel better, and live fuller. So don't underestimate the power of good squeeze and the right time to do it. If you got questions or want help figuring out where to start, I'm here. You don't have to do this alone. And thank you for your time today. More importantly, for showing up for your health. Thank you, guys.
Don't go anywhere, Chris. I can see some questions coming.
Yeah.
Robert Dogan.
I'll share this one.
You're muted right now. There you go.
Yeah, I think I'm online. Hey, I'm due to suffer a colonoscopy a week from tomorrow. Is there anything I should be aware of that I'm not, or are the two mutually exclusive from each other?
You already had surgery, right?
Yes, 2 months ago.
Yeah. So if you have colonoscopy, it'll be part of our treatment plan. We're going to talk about how you're going to do your exercises while you are wearing this colonoscopy bag. I've seen.
Wait a minute.
No, not a colostomy. He's going to get a examination.
Okay.
Colonoscopy.
Yeah. There will be no problem with that.
Okay. Well, there's problems already regardless. So,
yeah, I don't think you have to worry about procedure. They are just going to check how's the health of your intestines.
yeah, the one thing that I'm sure it's not specific to me, but constipation has always been an issue, and I talked with Dr. Chestnut about this before this colonoscopy came up, and he recommended I take Miralax. He prescribed Miralax, but at an increased dose, and that seemed to help. I mean, there's sometimes I'd have, when I'd have a bowel movement, some of them are like iron pellets that I'm pushing out, and then other times if the Miralax seems to be working, so I'm kind of all,
Could it be that you're not hydrating enough?
I think I get dismissive with the Miralax, and I'm like, after, it says on the bottle, it takes 1 to 3 days for it to become effective. And so, and then I'll have what I consider a normal bowel movement, and then I'll slack off on the Miralax, and then I get slapped in the face. No, you're going to be constipated if you don't take it. So I'm trying to be more vigilant about following all the guidelines they've got out there.
If you're asking my advice about taking Miralax, you just have to know that why are you taking the Miralax? It's definitely for constipation. But are you taking enough water on that one? Are you moving around? Do you have any restrictions on your intestine?
I think so. I guess this is the best I can, characterize it. I've been going back to the gym, And I'm careful with the water because, when I have to go, get out of my way, I need to, the urgency all, comes rushing back to me. So,
Right. But we
so
also,
it's,
yeah. Sorry to cut you off. But I think we also have to think about what's your body positioning when you are defecating, when you are pooping. You
yeah.
got, yeah. Um, there could be you could have some tightness on your back, on your hips, on your pelvic floor that you're having a hard time taking that out. I've had a visceral mobilization. I'm trained to do a visceral mobilization, meaning I could mobilize your intestines, your stomach, your valves, your rectum, so that it could help you go. Sometimes a simple breathing could help relax that pelvic floor so you can, um, have a good bowel.
Well, I'll report back after next Friday.
Mm-hmm.
But
If I put this may not be a cure-all, but I went to a gastroenterologist last year over bowel issues, and he tested for all the horrible things that he could test for and ruled them all out and told me to start eating fiber one every morning for breakfast. And that has
really,
really helped me a lot.
yeah, I mean, right now it's like they're saying adjust your diet, coming up on the colonoscopy, and then don't eat anything fibrous. Go to,
Oh, well, that's a different story, prepping for
yeah, I
the,
know. So I'm kind of wrapped around the axle about that right now.
Right. Yeah. So you gotta look into what other fiber sources you could take instead of Miralax or Fiber One.
Yeah, I'll tell you, the mirror, if I take it religiously, and everything, it works fine for a while. And then all of a sudden it stops working. So uh, we'll see what happens. I have to do I got uh, gastroenterology has me doing a double prep because it's always been an issue. So we'll see
Right.
what goes on.
And there's some
Other guys
questions.
have other questions for Chris today?
Yeah, so one asked if we accept TRICARE. I work with the Jackson Clinics, and you can see on the upper right corner, you can click that QR code. Take a photo of that QR code or check Mr. Fred Core's email. That's where you can find it.
And I have on something on that. I actually asked Dr. Chestnut to put me in for referral for physical therapy, pelvic floor, and the TRICARE doesn't do it anymore, and I'm on Medicare. So I just got a letter from TRICARE, and I'm coming to see you, Chris, on the 25th. But it was pretty easy to do. So you just have your doctor put you in for one, then the Medicare slash TRICARE, you're eligible to go do that. And then one other quick comment for Juan. Nurse Gray, when she recommends the ball and band, you're supposed to do that in conjunction with the Kegels. Just don't do the ball and band. Do the Kegels while you're doing the ball and band.
That's correct.
Yeah,
That's
thanks.
correct.
Yeah, that one explains. So, thanks a lot. Appreciate that comment, Chris. So he just said that that Tracker does not pay for it. So, Medicare does, but Tracker does not. Is that correct?
I Well, I believe we accept
Are you on
TRICARE if
TRICARE or TRICARE for life?
I'm on Tracker for Life.
Yeah, that's what I'm using. My Medicare and the TRICARE for life is the remainder backup.
Okay. No, I'm sorry. Yeah, this regular Tracker, not Tracker for Life. I'm sorry. Yeah, this regular Tracker.
yeah, if you guys have more questions about the payment or those kind of stuff, the best person to talk to is our front desk. Um, they're the one handling most of that. I have zero control of it. I make sure that I do well on what I do as a physical therapist, and they take care of the rest.
Hey, Chris,
Right.
got a question for you.
Yeah.
In is there like a society or a group of physical therapists that do male pelvic health? Because I'm down in Fredericksburg, and so the closest place to see you would be up in Shirlington, which is quite a bit of a drive depending on the time of day.
Right.
So, I mean, is there a place that you would recommend that we could go to find someone with your talents in our local area? Because I've just sold my house and will probably be moving out to Colorado. But for now, I'm living in Fredericksburg with my new girlfriend.
Hey, congratulations.
And I'm experiencing exactly the similar circumstances. I mean, a hug or, God forbid, a kiss, especially a good one. And man, we're talking leaky right away. And it's extremely embarrassing. And yeah, it's been a real life impact.
Ed just wanted us all to know he has a new girlfriend. That was the
No. It's just the whole reason that it just. I mean, oh my God! It's miracles happen at 76 after being widowed for 6 years, and it's a. Pardon my French. It's a fucking miracle.
Well, if you guys can see my screen, I put the website where it says that pelvicrehab.com. Let's see.
Uh-huh.
And then what's your zip code? For example, my
22406.
22406. And then you just put find. And then ta-da, this is the search engine for all the pelvic health therapists. And if you're looking for male, again, that's the most difficult part. But these are all the female therapists on the left side who could see you.
Okay, and so we have to go through the write-up on the left to find a male pelvic rehab person.
For male, that's there's no filters about the gender of the therapist.
I don't care about the gender. I just want somebody that's going to focus on my rehab.
Correct.
Post prostatectomy.
So the closest for you will be Talisa Cummings, Taylor, 10708 Ballantyre Drive. So it's the closest for you.
Yeah. Okay.
So pelvicrehab.com is a good resource for those who are looking for
pelvicrehab.com.
I'll type it on the chat box.
Excellent.
The next question is Squatty Potty. Yes, Squatty Potty is one of tools that I recommend to my clients just because we want the angle to be as close as possible to 100 degrees to relax that pelvic floor muscles. So yeah, you could get a Squatty Potty. I think that's it. Do you guys have any more questions for me? And I hope I answered most of your questions.
Lee, you have your hand up.
Yeah, Chris, I just wanted to give you a quick update on the things you said. I wanted to wait to the end, but a quick on mine. I'm a bit of a unicorn. Fred can nod his head. I was 2 years ago, and I'm a bit of a unicorn in what happened to me, and I worked with Dr. Chestnut. And we've talked, as the other folks were talking about, we talked about doing the exercises before the surgery, and actually even further than that, potentially looking at the pelvic floor in general in a form of a study to potentially identify people like me. And just to quickly give you my story, essentially, I had the surgery, I had no problems. I never leaked except for the first pull of the first calf. But I, about a month out, started having bladder spasms that then went to pelvic floor spasm, that then went to colon spasms. So basically, everything in my gut spasmed. It would take hours. Literally, I was hospitalized, and they gave me the legal amount of meds to try to knock me out. Couldn't even knock me out. Anyway, long and short of it was, I had the question of Nurse Gray because I didn't see her till afterwards. Didn't get the exercises till afterwards. And she was a bit upset because she pointed to equipment and said she could have seen my pelvic floor and known what was going on even when I was in the hospital. Anyway, I ended up ending go like 6 casts. I was in the hospital for days. I had the camera. I had all this stuff, and it resolved and it's all fine. It's just that I thought if he told me, Dr. Chestnut told me 107 surgeries after me, the same thing happened to somebody else. So I'm not a one of, but it's just a small number. And I said, if you could identify these people beforehand and not make them go through what I did, at least we could. Anyway, long and short of it is it could be that not only is it exercise good, because I believe personally that had I done the exercises prior, it wouldn't have happened, but it also could identify people who could be like me. And like I said, Nurse Gray told me that basically I had what a woman would have in childbirth contractions. Mine just lasted for hours at a time. So you can kind of get the idea of what it was like. And so anyway, that's what I wanted to tell you as far as if you talk to Dr. Chestnut, we actually had the conversation about should this be a study where you start looking for the pelvic floor prior to, and then it kind of identifying people who either have overly tight or overly loose before going in. So anyway, that's what I wanted to share with you.
Thank you for sharing that, Lee. Definitely, it will be nice to have a physical therapist, either myself or anyone, to be part of the preparation before the surgery, because it will be helpful for everyone to know what are they expecting afterwards. Because it's a lifelong journey, and you need to have someone and all or everyone to be behind you after that. Any more
Chris, we
questions?
appreciate your sharing with us today. And at least on the docket, Chris plans to come back next month. So if you develop some questions between now and then, bring them next month at our meeting here or call his office. I'll put his contact information up in the chat. And
Right.
Chris, you're welcome to stay as long as you want to here. And if there are any other questions, please holler. And I'm wondering, do we have any new patients here who are here for the first time?
Yes, me.
Joseph and Brian. Anybody else?
Yes, me. Isaac.
I'm sorry, who was that?
Isaac.
This is George. I don't have my camera on, but I'd been attending the evening one, so I just joined because of Chris being here.